Thank you all for joining us today. I am Tara Luzak, the Program Coordinator for the U.S. Bone and Joint Initiative. I ask that you keep yourself muted during the webinar. We will have time for questions and answers at the end. If you still have questions, please email me after the webinar and we'll get your questions answered. I would like to introduce the speaker for today, Dr. Elaine Husney. Dr. Husney is Vice Chair and Director of the Arthritis and Musculoskeletal Center within the Department of Rheumatology at the Cleveland Clinic. Dr. Husney is very active in both patient care and clinical research focused on examining health outcomes and novel therapeutics for patients with inflammatory arthritis, such as rheumatoid arthritis, psoriatic arthritis, and osteoarthritis. She is an active member of the American College of Rheumatology Board of Directors for the National Psoriasis Foundation, steering committee member of the Group for Research and Assessment of Psoriasis and Psoriatic Arthritis, Vice Chair Committee on Healthcare Systems and Providers for the OA Action Alliance, and on the Medical and Scientific Committee for the Arthritis Foundation of the Northeastern Ohio chapter. She is also well known to the U.S. Bone and Joint Initiative and involved with many programs. Dr. Husney has been an invited lecturer at both national and international meetings, as well as authored numerous publications as original research, reviews, and book chapters. She has had the opportunity to mentor both rheumatology and orthopedic research trainees, and this has been one of her most rewarding experiences. Thank you, Dr. Husney.
Thank you, Tara. I'm glad to be here. This is really a different type of seminar that I'm used to. So usually I'm talking to, a contact expert on a specific type of arthritis. But this public health seminar that the U.S. Bone and Joint Initiative has done has just really sparked my interest. I think it's really an area where we really need help of a team, and to have people being able to take this slide set, which has been really updated, and we'll go over that momentarily, has, I think, really useful information for patients, and I think can really change the paradigm of how we're going to treat this chronic disease. I think that most people with osteoarthritis are not, really banging down our doors to say, I want my knee replacement right away. I think they are looking for options, and I think experts in arthritis really provide a really comprehensive view of to patients that are suffering with arthritis and what they can do. So it's broken down into modules, and you guys will have access to this once you, become familiar with the slide set. And you can really take any of these modules that you want, or you could do it all at once. So here you'll see sort of an overview of the different titles of the modules, and I'm just going to break down some of these modules and sort of give my perspective on, how to use them, and would love to hear from the audience as well. Any questions you may have at the end. I'm just going to go through a breakdown of these modules. So the first one is really, what is arthritis? And this is probably the most, sort of overused term. And as a rheumatologist, we really, understand that there are many different types of arthritis. And one of the challenges is to really understand what type of arthritis the patient has, so that we can better help them with their symptoms. So there are many different forms of arthritis, but there's really two categories that we care about. One is the non-inflammatory, and the other one is the inflammatory form of arthritis. So the most common is the non-inflammatory, which is the osteoarthritis. And even that in itself, calling it non-inflammatory, we know now, since we know a lot more about osteoarthritis, that there are some inflammatory components. But as a whole, we really look at these two pathways. So inflammatory arthritis refers to the rheumatoid arthritis, the ankylosing spondylitis, so the type of arthritis that has many pro-inflammatory cytokines that are driving the disease, while in the non-inflammatory side of things, which is the osteoarthritis, is really more of the localized. And so this slide is really to remind people that as they are, talking to their church friends or Googling about arthritis, we have to be really careful of what type of arthritis that they're talking about. And here is a better slide to take a deeper dive into looking at arthritis. I love this cartoon. I actually use this cartoon even to teach the trainees, you know, looking at the normal joint and looking at where the action is in RA versus OA. So RA being rheumatoid arthritis, the action is really in the synovium. And when that synovium starts getting leaky and starts having an autoimmune sort of attack to it, is when it draws all the other cytokines to come, and it causes the inflammation of the joint from the synovial lining in. While in the osteoarthritis, so the cartoon picture all the way to your right, you see that it really starts at the cartilage level, and the cartilage is really the cushion that protects these bones, and really at the cartilage level is where all the action starts, and it starts eroding into the subchondral bone and causes all of the x-ray changes that we see, and then eventually the symptoms that patients have to deal with until they can really get a hold of their lifestyle back again. So I think this is a really important slide, a really nice cartoon that I used it when I was in training and still using it today. So in terms of symptoms, I think obviously there's a lot of pain in the joints and stiffness, but I think what people may or may not appreciate is how it may affect all the other areas. And, you know, with limited time in the office with the physicians, sometimes they really just focus on the pain and stiffness, but what really might be bothering them are all the other symptoms. And in the ensuing slides, you'll see focuses on fatigue and mental health. So before we go into that, then is the module 2, which starts all that taking control and self-management slide. So I think it's important to remind them that it's a team effort. It's really not just you go into the doctor's office and you expect a treatment plan that's tailored for you right then and there in the 10-15 minutes, but really it's all the people around you. It's your primary care that you see, it's a specialist that you see, it's a therapist that you see, as well as all the other people that you come in contact with that might be affected, you know, including the people at your work that you might have to talk to about the ways that you might have to, you know, modify your activity. So I think being a team captain slide and showing that you could be the center of this is also a very important message. Self-management, I think this term has been really used, maybe sometime overused. I think it sounds like it's easy to understand self-management, but I really have trouble sometimes talking to my patients about what empowers them and what their role is in their osteoarthritis care. And so I think the next couple slides really break down for them how self-management can look, what is their role in self-management, how do they take control, how do they understand to manage their pain, for instance. So this is a nice slide really looking at, you know, it's not just the medicines you take, but the activities you do, even the way that you might be sitting in a chair at home or in the office, but really taking control of that. So module 3 is probably the longest module, which looks at the, you know, different aspects of self-management. So here we had talked a little bit about, in addition to the joint pain that you see, the pain and swelling that can occur, but there's also sort of extra articular, what we say, are outside the joints that can affect you. And here are sort of that roller coaster of emotional health. So maybe in that one visit, it might not happen to you this week, it might happen next week. So the importance of looking at emotional health and looking at maybe making a diary of your symptoms. So having that sort of tired, angry, sad, other emotions that can be associated with osteoarthritis is also important to note. Fatigue, this is probably, as I see Dr. Strand is on this webinar, fatigue. My gosh, that is one of the toughest things that come into my office. Like, how do I measure it? What can I do? Is it related to your current symptom? Is it related to other symptoms? So I really think fatigue is one of the hardest things that I have to deal with. You can, you know, see how best can you cope with it? How can you plan your day? You know, look at, you know, times that you have more fatigue, times that you have less fatigue, and try to manage. But this is something that I think is a bit vague, but it's always good to make a note of fatigue and what works for you and what doesn't, and how much of your actual disease process is related to fatigue versus other things in your life. So obviously getting a good night's sleep is also important and part of all of this treatment for arthritis. Being active, we all know as rheumatologists, we want to keep you moving. It's sometimes counterintuitive for patients because they feel the more they move, the more pain that they have, and how do they deal with that cycle. But we do believe in modifications, and to keep moving and being active is still very important. So this slide really helps to bring that to your attention. Looking at diet is also something really, really important. We look at not just having nutrient-dense diets, but this is something you can control. We know that there's a lot of information out there, and one slide doesn't do justice of all of the different diets that you can do to be healthy, but it's important that eating more nutrient-dense, fresh fruits and vegetables are going to be better than processed foods. So this is a slide to remind us of that. And there's certain foods that, sometimes can make you feel more sleepy, carbohydrates, and looking at what affects you could be different. So I think to stay away from being really prescriptive about diet, meaning, this is the only top 3 things that you should be eating all the time, but really making them part of that diet conversation. What in the fresh fruits and vegetables are good for you? What tastes good for you? Who's doing the shopping? Should only be one person in the family doing the shopping, or really should it be more of a group effort where you can participate and really introduce foods into your home that is good for everyone? So not, everybody likes apples, even though we know fresh fruits are good. And so what other fresh fruits might be good for you, and adding protein. So all of those are really important to start that conversation about, and to allow a spectrum of fresh fruits and vegetables into your diet. Supplements, as we know, a big part of many people's lives. You can't really go into a grocery store or a nutrient supplement store and not be bombarded by advertisements on supplements. And there's really not the same type of sort of regulation that we see in medications that we see in supplements. So they can advertise anything to support joint health. And there's lots of questions. There's probably weekly that I have questions going over supplements. And we know that you really do need to at least open up that dialogue so that they are, talking to you about supplements, even though we don't have maybe good evidence behind certain supplements, but to just be aware of what people are taking, and for them to consult their physicians that they are taking this. And, many times I tell my patients, since there aren't good, recommendations or studies out, that perhaps you can, do it for 3 months and see if it helps before you sort of spend a lifetime of money on supplements as well. Along those lines are the alternative treatments that we see. As you know, we also have sort of non-pharmacologic modalities that are really good for osteoarthritis, including massage, acupuncture, many other sort of mind-body therapies that we see. And once again, these are, good to start and open that conversation, find out what people are doing, what works for them. And, these are sort of part of the entire spectrum of treatment, so not really something that replaces, it's really adjunctive to what you want. And I think that's important to note. I also think it's important for people to feel comfortable to tell you as a healthcare provider what they may be using as an alternative treatment. I think to keep that dialogue open, just because there's no, perfect study or evidence behind it, I still think it's good to be part of that conversation, and most importantly, to use it as adjunct to other self-management techniques as well. I think it's important to also helping those around. I think this is a great slide. I think many times people go to a doctor's appointments, come back, they feel that pressure that this is their problem, this is what they need to deal with, and sometimes they're not as open to all the people around them, whether it be coworkers, whether it be family members. So I think finding a way to help them dialogue for what osteoarthritis is, helping those around them to understand this pain is also, I think, very important for people to become confident to talk about. And those start with these seminars that you guys are having, these seminars that are allowing patients to hear in a much more relaxed manner, not in their 10-minute appointment, about how to help those around them. And I think that's where these public seminars are so important, even though these seem so simple to you, that, you know, patients really need to hear this again. And, you know, a slide looking at, you know, where you can be team members with your healthcare providers become really important. And I love these sort of, you know, cartoon pictures to really tell us the scheduling, the exercise, how to take your medications, how to talk to your doctor. These are also helpful, and, you know, I almost want these like in our waiting room where patients can kind of see it on their own as well. So I'm really excited to, you know, be able to talk about these slides, and love to hear from you guys about, you know, how you think you can use them and what environment these will be best implemented. So the last but not least is Module 4, which I think is really important. So this is really where the U.S. Bone and Joint Initiative has, you know, really taken initiative to produce this, but the next step is really how do you implement and really understand if they're useful. So these, in this module, you'll see a bunch of, a few slides, but I sort of distilled it into these questions, which are, what are the concerns that patients are coming to you? So if we don't hear from the patients, we are not going to know how to tweak this to be helpful. So what are the top 3 concerns for your arthritis, and what are the 3 most important things that you've learned from this session? I think are really great take-home messages, and how do we really get to a point where we are categorizing these statements so that we can bring them together to healthcare professionals and to people that have a public health mindset that would like to you know, really categorize these and get these concerns out in the best way possible. So these take-home messages, I think, become really important to help our healthcare professionals come to some sort of, I guess, consensus, you know, so that we can bring these together, because obviously, you know, as you're doing public health forums, you have so many of these messages that are coming at you. But I think the key is to see where the sort of top 10% come into play. And I would like to know, you know, are there differences among geographic areas? Are there differences among, you know, the types of cohorts that are hearing these public health messages, and how we can maybe tweak these as we are moving forward? So I'd love to acknowledge, you know, the advisory committee and all the hard work that goes into the USBJI for developing a program like this, and the collaborating organizations that all of us deal with, as well on a professional level, as well as on a local level. So I want to thank you for your attention. I know sometimes I speak fast, so I apologize for that. And hopefully there's some questions in our last 5 to 10 minutes that you would like to share with me or ask me, and any of your thoughts in trying to implement this out to the public. So thanks for your time.